As a cornea specialist, we really do see people who can be addicted to opioids after surgery. There's a wonderful group of researchers of the Institute for Health Policy and Innovation at University of Michigan. And they were studying post-surgical opioid use and really finding that you can get addicted to opioids after your surgery on the opioid pills you're given to manage the post-operative pain. And so I am colleagues with those people and realized that this was a problem in my own domain as well. So with the cornea service, we looked at how many opioid pills after surgery we were prescribing, and compared that to how many pills patients were using by calling patients about a week after their surgery, and they were using way less than we were prescribing. So we did that study over 6 weeks and then met with about a month later and immediately curtailed how many we gave and started giving a lot less. But then we also wanted to do follow-up and make sure by giving less we were still managing the pain properly, and also understand more about the opioid use. So we called patients, a second set of patients, and found that we were really adequately controlling their pain. They actually, when you prescribe less, they actually use less, and I think there's a lot more of a conversation about opioids now that we talk to our patients at the time of surgery. But the scary thing from the results of the study is that they still weren't dispensing any unused pills properly. So we really didn't have any patients who were doing the right thing, dropping them off at a police station or bringing them back to a medical center for proper dispensing, because of course what we're worried about is just dispersion into the community. I think that we, especially in the context of surgery, it's difficult because of course people are worried about their surgery, and then you sort of think about the pain control after that. And so we still need to we need to think about the whole surgical care of a patient, which is not only what are the risk factors for the surgery, what's the surgery outcome likely going to be, but what's the whole surgical care experience. I think we need to incorporate those conversations earlier, because now that we are doing that more, and now that the state of Michigan also mandates that we give education to our patients, it's really helped, I think, the communication, that it's not taboo to talk about or ask about or understand about people's pain and what they should be doing with pain control.